Yeah. Okay.
Okay, so communication scenario, the role is pediatric specialist registrar working on the children's ward in a DGH, setting side room of the children's ward. You are talking to Mrs. Mulholland, mother of 5-year-old Harry. Background information, Harry is a 5-year-old asthmatic. He was admitted to your ward 2 days ago with his third exacerbation of asthma. He is receiving a course of oral steroids and is nearly ready for discharge home. After discussing him with your consultant, you wish to start him on prophylactic steroids. Prior to this admission, Harry was receiving salbutamol via a spacer and was using this up to 4 times daily. He is an otherwise healthy child, with both height and weight on the 25th centile. Harry's father was with him when you saw Harry on the ward round. He was happy to start the recommended treatment. Harry's mother has come to the ward and wants to talk to you, as she is unhappy about Harry being on steroids. So you want to start the steroids, but Harry's mother is not willing to start steroids. So the task is, please discuss with Mrs. Mulholland the recommended treatment for Harry and try to answer any questions she may have. So steroids explanation. Anyone wants to be the role player in this case? If no one, then I will be the role player. Okay, doctor, are you ready, Dr. Hiren?
Yes. I'm ready. So set the timer and I will start.
Yeah, I'll set the timer. Total, you have 9 minutes, 6 minutes, and 3 minutes. You may start now.
Yeah. Hello, good morning.
Good morning.
I'm Dr. Hiren, one of the children doctor here. I think we met while during the treatment of the Harry. I believe I'm talking to Miss Holland.
Yes, doctor. Yeah.
So, Ms. Mulholland, thanks for coming today. I'm happy to share the news that the Harry is doing good now compared to the time of admission, where he was having some problem with the cough, but now he's ready for the discharge. So you must be happy now. Hello.
Hello. Sorry, doctor, your voice is not clear.
Yeah. So now Harry is for the discharge. So it's a good news that Harry is going home today and he's doing well and he's ready for the discharge today. So you must be happy, Miss Mulholland. Can you hear me? Can you hear me, Dr. Wakar? Hello. Hello. Is my voice audible? Dr. Bhatti, Dr. Rohel? Or is
Yes,
not
your voice is coming. Your voice is coming. I can hear.
Okay. So I think maybe problem with Dr. Wakar network. So can
Carry on.
anybody who can
Carry,
play the role?
just carry on. Carry on.
Okay, so just I will, for the sake of time, will restart.
Yeah.
So hello, good morning.
Good morning.
I'm Dr. Hiren, one of the children doctor. I believe I'm talking to Miss Mulholland, the mother of Harry.
Yes, doctor.
Nice to meet you. Thanks for coming, Miss Mulholland. So,
Same here, doctor.
today Harry uh, is ready for the discharge. So it
Oh,
is,
that's great, doctor.
yes, he's doing better, and there is a plan to give him discharge today. So it must be a good news for you.
Yeah, for sure, doctor. We are waiting for this.
Yes, Miss Mulhalan. Today I am here to talk to you regarding his discharge plan. Is that the right time to talk with you?
Yes, doctor.
Okay. Would you like anyone else to attend with you?
No issue, doctor. You can carry on.
So, Miss Mulholland, you know Harry has a condition called asthma. So, before we start our meeting, what are your updates regarding Harry's condition?
Well, they're told that he has a poorly controlled asthma, and they were talking about they're starting some new medication. It's like that.
Yes, yes, you are right. So, he was having, he's having condition called asthma, and in that condition, um, there is a inflammation of there is some swellings of the airways. So uh, as you are already aware that he is already on the admitted in the hospital third time, and
Yes,
he's
doctor.
on some medicine.
Yeah, we know he has asthma, and this is something like narrowing of the airway, and that lead to the difficulty in breathing
Right,
with the cough. Yeah.
right, right. So today I will explain you. Our plan is to start the other medicine called inhaled. Like he's right now on the blue inhaler, our plan is to start the orange inhaler, which is called inhaled corticosteroid. So, uh, do you have any idea about this medicine? Have you
Yes,
heard?
doctor. We know this thing. These are the medication for the asthma, especially when it is not controlled. That much I know. But I heard they have their side effects.
Yes. So this is called like the blue inhaler which you are giving is for the relief of the his cough or his breathlessness. Same way, this orange inhaler, it is for the prevention. So,
Okay.
in this condition called asthma, there is a swelling and there is a distortion of the airways. So, if we give this orange inhaler, it helps in prevention of the attack, and as this way it also helps in minimizing the episodes of the breathlessness or episodes of the cough, and it also helps in his school dropout because of this asthma attacks, as well as it helps in the peaceful sleep also and his day-to-day activity also. Am I clear so far?
Doctor, I'm confused because a lot of things you are telling me, I cannot get it in a once.
Yeah, no problem. If what I mean to say, we can discuss each component separately. Also, what I mean here is, if we start this preventer, it can help in a couple of ways. Like, for example, with a regular dose of this orange inhaler, he can have a less episode of cough. It helps in regular school also. Like, it might happen if there is a many episode of the breathlessness and cough, it must be compromising in his school presence, isn't it?
Yes, doctor. But he was okay with this medicine and he got 3 time attacks. But why are you considering this new medication? as it is having a lot of side effects.
Yes, I can understand your concern. Uh, you are right, there is some side effect with any medicine. But here, if we compare the side effect and the benefits are more because this medicine we give in the form of inhalation, so it directly goes to the airways and it has very less side effect in comparison to the oral steroid. Am I clear so
Okay,
far?
doctor. Okay, doctor, I don't understand what is oral and what is the inhale. I am very confused.
Yes. Ms. Mulholland, this is a very good question. See, Harry has been given the oral steroid, so this medicine will affect the whole body's growth and it affects all the organs of the body. But this oral inhaler, when we give, it goes directly to the lungs tissue, so it has a very less minimal side effect, and it
Okay,
will
doctor.
in improving the lung function also. Am I clear?
What if I don't? What if I don't like? If I don't use it, then what is the problem? We cannot continue same medication as before.
Yeah, if you don't want this, what will happen? Uh, his episodes may come and go, and it may make his day-to-day activity and his school presence difficult. It may compromise his sports activity also. So it is very essential to
6 minutes. 6 minutes over.
so it is very essential to start this medicine to help him to make his life better and comfortable without interruption of with the due to the frequent recurrence of this attack of asthma.
Okay, doctor.
So, Ms. Mulholland, do you have any other concern?
Yes, doctor. The thing is that I am not happy with this preventer. You are asking the steroid. I I better we would want to continue with same.
Yes, Ms. Mulholland, I can understand still that you are worried about the steroid. It is, I mean, I can understand that it's a little bit difficult for you to agree on this point. But what I can do, I can give you some leaflet about this condition. You can read about this, and if still after reading, after going through this leaflet, and still I can arrange another meeting, and we can discuss further on. And still, if you have a further doubt, we can arrange a next meeting, and uh, we can discuss if you have a further any question or concern about this.
Okay, doctor. I will discuss with my partner, and then I can tell you in the next meeting for this.
Yes, Ms. Mulholland. So, if you have no further concern, I would like to just go through the points which we have discussed today.
Okay, doctor. No problem.
Yeah. So, we discussed today in this asthma, there is a swellings of the airway and the main medicines. One is the blue inhaler, another is the orange inhaler. The orange inhaler is very essential in to prevent the further attack, and it also it also helps in reduction of the hospital admission because of the asthma. It also helps in his day-to-day activity, which usually due to the recurrence attack may get compromised. It also helps in the form of like regular school presence. Sometime if due to asthma, if child is not able to go to school, and if his education gets suffered because of this condition, then by regularizing the medicine like preventers in health corticosteroid as well as the blue inhaler, it can minimize the problems due to this recurrence attack of this condition. And as we discussed, like the side effect of this medicine is very minimal because we are giving in the form of inhalation and it directly goes to the lung. So it has minimal side effect compared to the oral medicine, which can affect the all other organs.
Time is over.
All right, so we can, if you have a still further any question or concern, we can arrange the next meeting. And thanks for your time.
Okay,
Yes.
thank you, Dr. Haran. So, Dr. Irfan, your feedback, please.
Thank you.
Yes, Dr. Heron, it was just okay. You tried your level best, a good attempt. But the thing is that you introduce yourself, you make sure that I am Mrs. Mulhama, and then agenda was explained very neatly, okay?
Mhm.
And you didn't check the understanding of the parents regarding your mother, that how you feel about his condition. Are you happy with the current medication? Number one.
Okay.
So, as your child is getting frequent attacks, so we have tried, we have planned to introduce a new medication. What do you think about this? So if you start like that, then check the understanding and acceptance of the new medication you are trying. Okay. So, and you check did you check the understanding regarding asthma? You asked me, right? I told, yes, we know what is this condition.
Yeah, you
But you asked me this thing, but you didn't give the difference. What will happen? You are trying, but it was not so effective. I mean, the statement or wording you tried. Okay, you should give a clear-cut statement. See, Miss Mulhama, as you are telling me that if we continue with same medication, I am afraid he will get frequent attacks. And poorly controlled asthma will affect his growth and his schooling. So she will understand what is why you are planning to start preventers. You didn't mention the name of preventer, right? I was the one who prompted you that preventer, right? So if you go like that, then give the difference with this medication and without medication. Okay. Then she might be accepting your ideas, and you should tell there's a lot of difference between inhaled and oral steroid that you tried. Okay, you tried, but it was not so impressive way to address the parents or mother, whatever. So if you go like this, give the difference. With this preventer, we can improve the quality of life. Okay, and with further education. Right? So what do you think?
Yeah, I think in the beginning, either we can directly.
Actually, what happened? You are distracted because of the role player was having no, I think, no sound from your side. That was also
the role player was not satisfied from the communication, right?
Yeah, no, just initially when he started the role play, you are not able to listen Dr. Haran voice. So that's why we switched to me. He switched to me from you.
Yes,
so,
because
this is a distraction. So that lead to the sometimes you cannot follow the track.
Yes, true.
So that is the main.
But nowadays we have to be trained ourselves. Nowadays virtual exam. anything can happen.
Yeah, right, for sure.
So anyone
So,
else has the comment?
so at the end, I'm just giving you the feedback. Then you should
Still
give
okay.
something like preventer and triggers, blah blah, something like that. You should have tell them, okay, so that it will give the full understanding for the parents. Then you should summarize that today we discussed that as is the asthma is poorly controlled, so we are planning for the preventer to start. That is steroids. Okay, we'll provide you information leaflet. We can have another meeting. Okay, and the sport group here to introduce, so that they should get their anxiety relieved. That's, I believe, it is.
But
Okay. Yes, right.
Dr.
Thank you.
I just want to ask you, I
Yeah,
explained
sure, sure.
risk versus the benefit, and still the
Yeah,
mother was not willing to start. At
yeah,
that
yeah.
point,
You are right.
do
Yeah,
maximum.
I'm afraid. Yeah, you should say, I am afraid if you are not going to, if we are not going to start this medication, he will get frequent attack that eventually affect his growth and his schooling.
But that you
So
already
when,
explained. No, that is what risk versus benefit. Like if you don't start, his day-to-day
yeah,
activity will be compromised. His sport activity can be compromised. His schooling will be
yeah,
compromised. What else you will
yeah,
show
that is
back?
this is the main concern from parent or any parents. Their main concern is the growth and schooling. If they heard, if they listen that it will affect eventually their growth, they will consider the new medication.
You can
And
repeat
then
again,
you can,
Dr. Hiren.
Hmm?
You can
sorry.
repeat this your statement. If already you have explained, maybe sometimes they are not getting. You can repeat all the things again. And
Hmm.
if you will not go for this treatment, what are the harmful impact on the child and the family, and what are the benefits? So also tell them the benefits.
Yeah.
If you will start the benefits, like he will live like his peers and he will enjoy his
Yeah,
playing, and he will not feel anything in his education. You will feel he's growing in his education. His growth will be nice, good. So
Yeah,
these things benefits you also take.
yeah, you can say this is the best way for the fast and optimal recovery. Okay, to start this
Mm.
medication.
Right.
So when parents
Okay.
heard, when they hear that this fast and optimal treatment, and it will help, they might go for it.
Okay. So Dr. Sandeep, yes, do you want to say something?
yeah. When mother is too much resistant, we can say like think what will be better, starting a inhaler with minimal side effect and having better quality of life,
Yeah,
or
same thing.
having the bad quality of life by preventing the inhaler. Put the blame on her, like who put the ball in her court. Then they will
Yeah, yeah,
she will
for
choose.
sure. Option, no, no, give option
Yeah.
to her.
Few option.
Give to
What
her
will be
option.
better? Starting the
Yeah,
inhaler and have a good quality of life, or not starting the
yeah,
inhaler and having the frequent attacks. Then she will be
yes,
more into thinking mode. That will be
yes.
better.
Okay. So anyone else has the feedback about this communication?
Yeah,
Anyone
I
wants to
have
add
one
something?
feedback for Dr. Hiren.
Yes.
Yes, please.
Yeah, Hiren, the summary was like a very long summary. If it
Hmm.
could be a shortened summary,
Yeah,
like
sure.
shortened summary. There we can say like today we have discussed regarding the uncontrolled asthma of your child, and we have discussed
I
what are the
discussed
types
this
of
thing already.
inhaler, what are the advantages of the
Mhm.
inhaler, and
But the
uh,
time, actually, the
the
time
side effect.
was
Let's
there.
just yeah, okay, okay,
So what
that's
he
okay.
will do after summary?
Yeah, okay, right.
So if there is time, it depends on you should have the skill to extend the summary to shorten the summary.
Dr. Wakar, actually, uh, there was not much time, and
Mm.
usually in summary, you must give the bullet points rather telling everything, each and everything at the in summary. We should sum
No,
up.
Dr. Hiren
Okay.
has the time actually because you said the 6 minutes, then I think, start after 30 seconds the summary, and he knows that there is this time I can finish it. I
Okay.
think
Anyway.
he went appropriate on the time, which I feel.
Okay. No issue.
So we have to highlight
Anyways,
bullet point, like instead of this thing in detail, we have to, so like we discuss advantage, disadvantage, the type of medicine.
highlights and what you have discussed, not the new thing. Do not tell the new thing actually.
Mm-hmm.
No. If
In
you
summary.
in the summary, if you forget something to add, you can mention. Okay, we can introduce this thing also.
Mhm.
You can add your things. There's no harm.
Okay,
Instead, you
we
forget.
can add that.
Yeah, you can add.
Yeah,
Maybe you in the
but like
maybe yeah.
Dr. Irfan, adding a new point in last 1 minute will again you cannot be able to conclude the summary. You cannot be able
No.
to
That's
conclude
no. It's
yeah. And
uh, some
lastly,
people
the
even say
summary.
even some people say it's not mandatory to summarize. If you have covered up everything, if you have covered all the aspect of the discussion, so they will
But like,
accept it.
yeah, that's true. Summary is not compulsory. But introducing a new point in last 1 minute can be a dangerous thing.
No. I'm asking. No. I'm not telling you. Suppose you forget something is very important,
Yeah.
so you can add at the end. No problem.
Okay.
Oh, what? How about this? You can say like this.
Okay, we will go for the next scenario, and the role player, sorry, the candidate is Dr. Sandeep and role player is Dr. Zafar. So just let me to start again meeting, please, because time it will be close in few minutes.